Hello everyone, welcome back to our awareness session on intrastomas or intestinal stomas. I am Dr. Rajesh Shinde, consultant, gastrointestinal, HPB and colorectal cancer surgeon at Apollo Hospital, Navi Mumbai. Today we have with us Dr. Varsha Gore. She is a chief nutritionist and integral part of our colorectal cancer management group. As we are talking about intestinal stomas, it is important to discuss about the dietary modifications of these patients. This is particularly important because this patient with stomas will have some changes in their bladder and bowel habits. For example, patient with ileostomies, that is the small intestinal stomas, will have a more of a liquid stools coming out, and they have the propensity or the tendency for deficiencies in the minerals and the nutritions. So these small aspects are also very important in when we are doing management of the stoma patients. So Dr. Vasha, can you tell us what are the broad principles of nutrition therapy in patients with stoma?
Correct. So nutrition is the integral part, as Dr. Rajesh said. So when we talk actually about principles of nutrition therapy, nutrition is all about living healthy. So we have to achieve that post stoma also they are able to have a healthy life. So the first principle is to maintain the healthy body status.
Okay.
That means if they are malnourished, correct the malnourishment and bring them to their ideal body weight, maintain their muscle mass. So this is the first principle. Second, to correct the nutritional deficiency. For example, they are going to have outputs like in ileostomy. There is going to be output. There is a lot of water loss. Along with water loss, there is going to be deficiency of the water-soluble vitamins, micronutrients. So this needs to be replenished through a good diet. These patients, the third principle is they will not be able to eat a plateful of food. They feel like eating, but they are not able to eat plateful of food. So we plan small frequent meals so that the digestion is easier and they are able to tolerate and the output is limited. So these are the main 3-4 principles which we kind of focus in our patient management related to nutrition.
Dr. Varsha, can you tell us about are there any particular foods which should be preferred by the patients, or are there any foods which should be avoided by the patient with stoma? And if why so?
Okay. So to make the patient understand, what we do is we kind of give them a allowed list and avoid list. Simple thing is like the food is allowed. For example, first let me tell you what foods are good and what should be restricted. So as we discuss and understand that stoma is going to be there, so we plan foods which are easier to digest. So what we will be avoiding is high fiber food because they are tough for the part, and then on the stoma it is a pressure. Second, food which are high in smell, they have high fiber content, especially insoluble fiber. We try to cut down. So we give a soluble diet, or we give a diet which is more in starch. Now we have to be more mindful about fruit and vegetable selection. So talking about fruits which I was just mentioning, if we take an example of orange, the skin at the segment of orange is high in fiber. So we'll avoid. Patient feel like eating orange which is rich in vitamin C, micronutrients. We ask them to peel off the segment and eat the segment. So this is how the pulpy fruits are better. So you name it banana, papaya puree. Apple. Now apple, the skin of the apple has a lot of fiber, but inner contents, most of us like eating apple. So the way they will eat an apple is different. We ask them advice, to initially remove the skin. If required, steam it or stew it. So by cooking technique, we are changing we are making the fiber more soluble, easier to digest, and the patient is able to, enjoy the eating apple.
And what are the foods that should be avoided?
So, as I was mentioning, the high fiber foods which are difficult to digest take a longer time. So, spicy foods should be avoided. Second thing, high fiber foods, especially corn, beans, peas. So, if we are taking, we'll be again changing the texture of the food. Broccoli, or there's a lot of craze. People feel, oh, broccoli is a healthy food. That particular food group, if you want,
or
you can take
gas
it.
producing
Yes, the gas
substances
producing
like onions or
Yes,
garlic, so that
garlic.
the pungency goes down.
Yes. When I said spicy, it also talks about these strong smelling foods or the cruciferous foods, what we call is that is the cauliflower family, onions, garlics. So that needs to be in moderation. If they want the flavor, we tell them to extract, like a soup form and mix it with the food rather than, using it as a, you know, our routine Indian tadka.
So what I get from you now is this patient will essentially have a normal food only, but there will be some changes.
Yes.
They don't need any particular kind of special food, or they don't have to order any particular food or any formula food from you.
Generally what happens is, yes, I do get your question, we try to modify the eating habits. Like if you have a small child, we
Yeah.
tell them to follow the same familial pattern, so they'll be eating more or less similar food, but we may eliminate certain components of food like high fiber food, gas producing foods which are tough on digestion. Eating fresh food is beneficial. Supplement their diet with micronutrients, that is vitamins, vitamin C, the water soluble, and adequate fluids is very important, so that there is no dehydration. And drink small quantities, eat small quantities, because then the absorption is better.
So what are the advice for a long-term management or the long-run management of these patients with stomas?
So before we give advice, I would always request, and our team will always give a reference to a dietitian, because staying connected with the patient is very important, because we know your eating pattern.
Yeah.
And we are going to counsel them, because what we had planned initially, suppose we had planned a very strict low fiber diet, but later on as the functioning improves, or if it is a temporary stoma, you have to correct that diet, and he is permitted to eat. So the diet correction is going to change over a period of time. We count the calories, so we ensure and we motivate the patient that they are eating a healthy plate. Then third, manage their fluid, check about their stools, look at their reports, allow them little fiber but which is soluble. So for example, if it is diabetic, or we may plan with oats, we may plan with wheat starch. Initially, if you Google it up, you will find there is no need to eat wheat. Your common foods are out of the list. So it is not about just referring, this list, but meet your dietitian, include all the food groups, and modify the consistency as per the patient requirement.
Okay. Thank you, Dr. Varsha, for sharing your valuable knowledge with us. So, if we are having a stoma, if someone is having a stoma, there is absolutely no reason to fear or worry about the dietary habits of the patients or the dietary modifications of a particular patient. They can have their normal food if they love sweet, if they love spicy. Everything is possible, and they don't have to change it really, but they have to do some modifications like on a case per case basis. Thank you.
Thank you.